Hi, I'm Sherry Mata, and I'm speaking today on persistent complex bereavement disorder. It is not actually in the DSM as of yet. However, it's in the back of the book to look at for future study and to have a little more research done. And the disorder will hopefully be available for use in the next DSM. The reason I chose this particular topic is because what the DSM is considering persistent complex bereavement disorder, I just call traumatic grief. And I believe that due to what's going on in our communities and the amount of violence, the amount of guns that are out on the streets, and the statistics show that we really do need a disorder that addresses for those who've experienced trauma and as a result of trauma have grief that's complicated and persistent. Another reason I chose this disorder is because of the work with Journey Forward. Journey Forward is a local nonprofit who is addressing this particular issue. It was started by Kathy Taylor because her son, which was my nephew, was murdered in Houston. And as a result of her finding meaning and purpose from that trauma, we've put together 3 components to address the mission of Journey Forward, which is to create a community and culture of nonviolence. Those 3 components are education, in which we go out and speak to the local independent school districts, the students who are attending advanced placement courses or dual credit courses. We also reach out to the local juvenile detention center and conduct presentations there, as well as local churches and other city events. Another component is addressing the support and encouragement that a mother needs after she's been notified that her child has been murdered or has committed suicide. So we reach out to those mothers individually, and we have what we call the Circle of Mothers, and it's a support group to help assist mothers and sisters and grandmothers through the grieving process. We describe traumatic grief as, or healing from traumatic grief as a before and after, because you're never really going to be the same. You have your before life and your after the traumatic event life. So the third component that we have added recently to Journey Forward's programs is counseling. And so we're now offering individual and group counseling for mothers and the siblings of those who have been lost due to gun violence. The criteria that need to be met for diagnosing someone with persistent complex bereavement disorder include, number 1, they have to have lost a loved one due to a traumatic event. So death of a loved one is the first criteria. The second area of criterion are grouped, and they have to have at least one of these issues to meet the full criteria of persistent complex bereavement. One of those criteria are intense feelings of loneliness and emptiness, recurrent thoughts of life being meaningless without the deceased, and a frequent urge to join the deceased, and frequent preoccupation, and an intense, persistent yearning that just doesn't go away. The second set of criteria, individuals have to have at least 2 of these issues in order to meet the diagnostic criteria. Feeling shocked, stunned, or numb since the loved one's death. Feelings of disbelief or inability to accept the loss. Rumination about the circumstances or consequences of the death. Anger or bitterness about the death. Experiencing pain that the deceased suffered or seeing the deceased. Trouble trusting or caring about others. Intense reactions to memories or reminders of the deceased, or avoidance of reminders of the deceased, or the opposite, seeking out reminders to feel close to the deceased. And again, an individual would need to meet two of those issues to be diagnosed with persistent complex bereavement disorder. Ways in which I would assess this disorder would include paying particular attention to nonverbal behaviors, but also verbal behaviors, because once someone has told you they've lost a loved one due to some traumatic event, there's just going to be issues of depression, sadness, grief, possible anxiety. So we want to also pay attention to what the client's telling us, the verbal description of what they've experienced, but also the nonverbal behaviors. I would also use the Beck Depression Inventory and Coping with Stress Inventory, because I think it's going to be important to address positive coping strategies at some point in treatment. As far as treatment, there are evidence-based treatments, not as many as I would like to see, because this is still a new disorder, and in previous years, individuals would have been diagnosed with complicated grief and PTSD. However, these individuals don't always experience everything that someone with PTSD would experience. So I'm really glad, again, that the medical psychological community is looking at this particular disorder for the next version of the DSM. As far as treatment goes, first I would treat someone in individual counseling. I believe that group counseling is very important, but the individual has to be stable and ready for group counseling. So I would start with individual counseling, and the first thing I would like to treat is any kind of panic or anxiety that they're feeling. So I would look at teaching them relaxation techniques to calm them down to where they can begin to process in counseling. So mindfulness meditation would be one choice. Progressive relaxation, muscle relaxation would be another choice. And I would use visualization and deep breathing exercises. And I would also include yoga techniques. And I would introduce these one at a time at each session so that we could practice them. And I would include psychoeducation so that the individual could use these techniques at home as well. Once the individual is calm and is able to process what's going on in counseling a little easier, I would move to normalizing their experiences of trauma. When an individual goes through a traumatic event, there are certain things that are typical behaviors, and I would want to normalize those so that they don't feel like they're, quote, crazy or losing their mind. The third thing that I would do is dispel any myths, because there are a lot of myths out there about losing a loved one. People will say, oh, time heals all wounds. But no, in this case, time is never going to heal that wound. You will be able to function afterwards, but I don't believe that time ever heals. Another myth is that most marriages don't make it through the loss of a child. So all of the various myths that are out there, I would dispel those myths and help the client to recognize that those feelings that they're having are normal compared to others who have been through traumatic events and lost a loved one. And also expelling those myths will help them to be better prepared for future counseling sessions. Thirdly, I would foster resilience. It's important that these individuals recognize where their strengths are and what strengths they have themselves, in addition to who is in their life that's been supportive. After the loss of a loved one due to a traumatic event, most people don't know how to react to that particular individual any longer. So they say things that actually hurt and don't help. Not meaning to, but it happens. So it's very important that we're able to identify who in their support network are the true individuals they need to be talking to, spending time with, in order to be able to foster resilience. Because every individual that I know that has lost a loved one due to murder or suicide or hurricane, some kind of natural disaster, each one of them have said, I'll never be the same. You're not the same person. There's the before you, and then there's the after the traumatic loss you. So it is a new you, and you have to find new ways to live and be successful. I would also include other psychoeducation materials such as the difference between grief, traumatic grief, complicated grief, and shame versus guilt, because a lot of these individuals will feel guilt that they weren't there to protect that person, or they will feel shame. You know, it should have been me. I should have been the one. Shame on me. So it's important to help these clients understand that that grief and complicated grief are very different, and that there is hope. We would also look at identifying the different symptoms of depression, PTSD, panic attacks, and anxiety, because these individuals may experience all or some of those symptoms. So it's important that they're educated and understand the differences between these various disorders they may experience. Once a client's ready to process information and able to deal with their thoughts, feelings, behaviors, I would move into some Gestalt activities, maybe the empty chair, possibly letter writing, writing the letter to their deceased loved one, writing a letter back from the deceased loved one, so that they can continue dialogue with that individual and maybe have an opportunity to dismiss some of that guilt or shame. Maybe forgiveness needs to happen. And so writing letters back and forth would help to increase the opportunity for forgiveness and reducing guilt and shame. Also, identifying coping strategies is going to be important. We want to identify those that the individual is using currently and talk about any of them that are negative coping strategies, and look at some more positive coping strategies to assist in moving forward in life. Life for these individuals will never be the same, so it's basically helping someone function at a higher level after the fact. I would include thought field therapy at some point. There's a lot of statistical research that shows not only thought field therapy, but eye desensitization has been helpful with reducing the effects of trauma. So I would incorporate those as well. And again, I would wait until the individual was ready for those particular activities. If the individual presents with the inability to really process through counseling, I believe that I would suggest that they contact their psychiatrist or their family doctor for medication. Not that they would need to be on medication forever, but being on medication for a time period could help them process through counseling a little bit quicker and get to the point to where they're functioning well. I hope you've enjoyed this video, and if you have any questions, feel free to email me at sherry.mata@tccd.edu.